If you or someone you know has been diagnosed with heart failure, this video will help you understand this condition, the symptoms, and options available for managing and treating more advanced heart failure. Heart failure is a widespread condition that is serious and without treatment can lead to death. The term heart failure means your heart is weakened and can't pump blood well enough to meet your body's needs. Some common causes are heart attack, high blood pressure, heart valve problems, and cardiomyopathy, a disease of the heart muscle. So how do you know if you have heart failure? There are several important signs. If you're experiencing any of these symptoms, it's important to talk to your doctor to help determine if they may be caused by heart failure. Without realizing it, symptoms like these can limit your activities and lifestyle. While there is no cure for heart failure, your healthcare team can help track your symptoms and develop a management plan that is right for you so you can live longer with improved quality of life. It may start with lifestyle changes. Your doctor may also prescribe heart failure medications. Even with a plan in place, your heart failure will progress over time. It's important to recognize if your symptoms are worsening and understand your heart failure class. As symptoms worsen, your doctor may suggest you be evaluated for advanced options to manage and treat your heart failure. With innovation and technology available today, there are more options and therapy choices for advanced heart failure. Implantable cardioverter defibrillators slow irregular heart rhythms that are too fast. Cardiac resynchronization therapy restores coordinated pumping between the right and left side of the heart. Mitral valve repair helps the mitral valve close and restore normal blood flow. Tricuspid valve repair helps the tricuspid valve close and restore normal blood flow. Pulmonary artery pressure monitoring is part of a care plan that allows for remote management of heart failure. A left ventricular assist device, or LVAD, is a small heart pump that helps the heart circulate blood throughout the body. In some cases, heart transplant may be necessary. It's important to talk to your doctor and ask questions. If you have advanced heart failure, your doctor may recommend that you see a heart failure specialist. By better understanding heart failure, you can make informed decisions to manage your condition and live a full, active life. To learn more, visit the American Heart Association website at riseabovehf.org. You can also download their Heart Failure Path app.